Today, Dr. I Am Jumpy has ordered a Mandatox 0.1 mil intradermal injection for patient Skip Rocker, date of birth of 1/1/72, and I will be administrating this. The first thing I want to do is make sure that I check the patient's 6 rights, which is right patient, right time, right dose, right route, right medication, and then of course right documentation. And I want to make sure I have good hygiene as I am administrating this, washing my hands before I draw the medication, and of course washing my hands before I administer the medication. So I'll go ahead and wash my hands, and I will again check the MAR to make sure that this is the right medication, right dose, and right patient. I will check the vial to make sure there's no cracks. The expiration date, which this one is 4/27, so we are good. I will, if this is a multi-use vial, I will initial my initials, put today's date, today's time when I opened it, so people know when I open it, so they can make sure that it's still good when they go to use it. If I need to mix the solution, I want to gently roll it in my hands. I don't want to shake it vigorously. And so then I will clean the top of my vial with an alcohol swab. Go ahead and clean it. And then I'll take my 1 millimeter syringe and I'll get that ready. And the first thing I want to do is pull air back to the amount of medication that I want to administer, which again is 0.1 mils. And I'll go ahead and take the cap off. And I'll put it in the vial. And then holding it up at a 90-degree angle, I'll put the air into the vial and pull back, putting the 0.1 medication into the syringe. And I want to get any air bubbles out, so I'm just going to hold on to the syringe and the vial and get those out. Again, putting it to 0.1. I'll go ahead and pull my needle out, and I'm going to recap my needle. You don't want to do this if you don't have to. But if you're going to be taking a prepared syringe and needle to a patient's room, you want to recap it for the transfer. You don't ever want to recap a contaminated needle unless the sharps container is across the room, and then you can recap, but you want to just throw any needles you can just straight into the sharps container so you don't risk yourself getting a needle poke. And I will then get everything ready for going into Skip Rocker's room, and I'll need a clean pair of gloves, and I'll need another alcohol swab. All right, so I would now be taking my medication into the patient's room. So again, I would knock before entering the room, ask for 2 patient identifications. So I'd, hello, Skip. Can you please identify your date of birth and your name for me? And of course, he would tell me his name is Skip Rocker, date of birth of 1/1/72. I would check his allergies, which Skip is allergic to Celebrex. And so I'd make sure that before administrating or even pulling the medication out, that he wouldn't have a reaction to this medication. I would make sure I had the right medication. It was the right time, the right route, the right dose. I would pick a location to enter or to administrate this medication again, and I would probably want the forearm here is the location that I'm going to be picking, and I would make sure that the patient could give me his arm, and so I would reposition him so that both him and I were comfortable, and we weren't trying in a funny position where either one of us were straining at this time. I would wash my hands, and so wash. I would put on my gloves. and I would clean the skin or the area that I would be administrating the medication with an alcohol swab, and I'd want to start in the center and make a circular motion all the way out, just like this, and throw that away. I would then go ahead and take my needle off, or my needle cap off, and I would let the skin dry before I would administer. I would take my non-dominant hand and pull the skin tight, and take my dominant hand with my needle and my syringe and insert it at a 5 to 15 degree angle just into the skin, just slightly, about 1/8 of an inch. I want to be able to see my needle and the hump of my needle, or I should be able to see the needle or the hump of my needles, because I shouldn't be going in very deep. And then I want to slowly administer the medication, and it shouldn't squirt out like that, but since I'm not doing this on a real patient, it does. But I want to administer it slowly, and I should see a whelp form. I go ahead and pull this out, and I would discard my needle and my syringe into a sharps container. I would take a gauze and just dab the area that I administrated the medication into, making sure not to rub or anything. And I want to make a circle with a pen about 1 inch around where I administer the medication, where that whelp is, so people know where to check when checking for a reaction. I need to let the patient know that this site needs to be looked at here in 48 hours, and I would give the results to Dr. I am jumpy. I would then document after everything, cleaning up my area, throwing everything away, making sure my needle is in the sharps container. I would remove my gloves, wash my hands. I want to make sure not to put a Band-Aid over this or anything. And I would then go ahead and document where I administered this, what I administered, what time it was, and the dose, of course, of what I administered into Mr. Skip Rocker.